Welcome back, guys and gals. Today we are talking about the muscles of mastication. These are the muscles that are responsible for moving the mandible up and down and backwards and forwards when chewing. So I know you guys are so excited, just foaming at the mouth for this muscles of mastication. But before we get into the individual muscles of mastication, let's go over some basic points. So every muscle of mastication is innervated by the mandibular branch of the trigeminal nerve and has an origin and insertion point. A muscle is also able to perform more than one action. But what do we mean when we say origin and insertion? The origin of a muscle is the immobile part of the muscle which pulls the insertion region towards it. And the insertion of a muscle is the mobile part of the muscle which is pulled towards the origin region. For example, the origin of the temporalis muscle is the temporal line on the lateral surface of the temporal fossa. And the insertion is in the coronoid process of the mandible. So the origin would pull the insertion towards it in order for the temporalis to elevate the mandible. Speaking of movements, there are 4 different actions that the muscles of mastication allow the mandible to do. Depression is the downward movement, elevation is the upward movement, protrusion is the forward movement, and retrusion is the backward movement. So now we'll move on to the individual muscles. First we have the masseter. The masseter is innervated by the masseteric branch of cranial nerve V3. Its origin is the zygomatic arch, and its insertion is the lateral part of the ramus and the lateral part of the angle of the mandible. In a way, we can imagine the masseter wrapping around the mandible. The masseter is responsible for elevating the mandible. So one of the masseter's main actions is elevation. The superficial fibers protrude the mandible, while the deep fibers retrude the mandible. All of these actions are important for when we chew and when we speak. It's also important to note that the masseter is the muscle that is associated with the pain felt by people who have bruxism. The next muscle that we're going to talk about is the temporalis muscle. So the temporalis is innervated by the deep temporal branch of cranial nerve V3. Its origin is the temporal line on the lateral surface of the temporal fossa, and its insertion is the coronoid process of the mandible. So the insertion gets pulled towards the origin. And the actions of this muscle are elevation caused by the anterior fibers and retrusion caused by the posterior fibers. And now let's move on to the next muscle, which is the medial pterygoid. The medial pterygoid is innervated by the pterygoid branches of cranial nerve V3. Its origin is the medial surface of the lateral pterygoid plate, and its insertion is the medial surface of the ramus and the angle of the mandible. So again, the insertion is pulled towards the origin, and the actions are elevation of the mandible and protrusion of the mandible. All right, now let's move on to the last muscle that we're going to talk about, which is the lateral pterygoid. The lateral pterygoid is innervated by the pterygoid branches of cranial nerve V3, and the superior fibers originate from the infratemporal crest of the sphenoid bone. The inferior fibers originate from the lateral surface of the lateral pterygoid plate. And now we're on to insertions. So the superior fibers insert onto the joint capsule of the temporal mandibular joint. And then the inferior fibers, they insert at the condylar neck. All right? So now what are the actions of the lateral pterygoid? So it's responsible for depression of the mandible and protrusion of the mandible. So on top of all of this, it's important to note that the lateral pterygoid is associated with condylar fracture because it attaches directly to the condyle. To summarize, there are 4 different actions that the muscles of mastication allow the mandible to do. So the lateral pterygoid, this depresses the mandible. The masseter, the temporalis, and the medial pterygoid elevate the mandible. The masseter, the medial pterygoid, and the lateral pterygoid protrude the mandible. And the masseter and the temporalis retract the mandible. So now that we've gone over the muscles of mastication, let's try some example questions. So example question 1. So each of the following muscles is responsible for elevating the mandible except one. Which one is the exception? So we have the 4 usual suspects, and take a second if you need it. So the correct answer is D, the lateral pterygoid. The masseter, the temporalis, and the medial pterygoid are responsible for elevating the mandible. The lateral pterygoid is responsible for depressing and protruding the mandible. And next, another question. So example question 2. Where is the insertion for the medial pterygoid muscle? The lateral part of the ramus, the angle of the mandible, the coronoid process of the mandible, or the condylar neck? So you can do your own drum roll at home, but the answer is B, the angle of the mandible. So the masseter inserts at the lateral part of the ramus, the temporalis inserts the coronoid process of the mandible, and the inferior fibers of the lateral pterygoid insert at the condylar neck. And if you've been counting along at home, the next one is example question 3. Which muscle is felt when the cheek is palpated? So again, the answer choices are the usual suspects, but the correct answer is A, the masseter. So the temporalis is palpated on the temple area of the head. The medial and lateral pterygoids are difficult to palpate, but can sometimes be palpated intraorally. And now I've got one last question for you guys to chew on. Example question 4. Get it? Chew on? Because the muscles of mastication? Whatever, all right? Which muscle is most likely involved in this patient's myofascial pain dysfunction syndrome? So we have a male patient, he's 30 years old. So his main complaint is that both sides of his face have been hurting since the school year started, and the background is that he has myofascial pain dysfunction syndrome, and the current findings is that the pain on the bilateral extraoral palpation of the angle of the mandible. Now I highly recommend pausing this for a second, taking in what I just said to you, and considering all of the answer choices, but the correct answer is A, the masseter. So myofascial pain dysfunction syndrome is a chronic condition that causes pain in the musculoskeletal system. The pain is often associated with trigger points in muscles which radiate pain to the affected area when pressure is applied to them. Since this patient feels pain when the angle of the mandible is palpated, the masseter muscle is most likely involved, given that the masseter inserts at the angle of the mandible. And that's that. So let's move on to a summary of everything that we talked about today. The first thing we discussed is that the muscles of mastication are the masseter, the temporalis, the medial pterygoid, and the lateral pterygoid. And then we discussed that the muscles of mastication are responsible for elevating, depressing, retruding, and protruding the mandible. And then we discussed that every muscle of mastication is innervated by the mandibular branch of the trigeminal nerve. Thank you so much.